In yet another instance of stifling the truth, YouTube has started pulling down videos featuring two doctors from California telling the news media that sheltering at home is worse for your health than facing the disease. We'll look at their data and try to explain why YouTube would pull it down in this episode of Analysis Behind the News, where we provide the perspective that you can use to restore American liberty and independence. Dr. Dan Erickson and Dr. Artin Masihi, co-owners of Accelerated Urgent Care in Bakersfield, California, pulled together a news conference to report on their findings of testing more than 5,000 people for COVID-19. As the New American Magazine reported, they are a primary provider of tests for COVID-19 in their county. Between the two of them, they have more than 40 years of hands-on experience providing medical care and in treating viral infections and respiratory illnesses. When the news conference first started, Dr. Erickson commented on how we all hear the mantra about following science. And then he asked, well, are we following the science? While he didn't answer his own question at that moment, his data concluded that we certainly are not following science. Let me read to you a couple paragraphs from the New American article by Dennis Barrett. According to Dr. Erickson, first of all, the models that predicted doomsday scenarios and were used as justification by political figures for the lockdowns have proven wildly inaccurate. Actual data proves that the infection is very widespread, making death rates considerably lower than predicted by the models preferred by public health politicians and bureaucrats. What is materializing in the state of California is 12% positives, notes Dr. Erickson. We have 39.5 million people. If we just take a basic calculation and extrapolate that out, that equates to about 4.7 million cases throughout the state of California, which means this thing is widespread. That's the good news, he says. We've seen 1,227 deaths in the state of California with a possible incidence or prevalence of 4.7 million. That means you have a 0.03 chance of dying from COVID-19 in the state of California. Again, 0.03. Some basic points that they revealed in the conference include 1. Sheltering in place decreases your immune system. And this is particularly dangerous when everything reopens, as overall sickness and disease will spike. Yet, many hospitals have furloughed employees and closed parts of their facilities. That's not a good combination, and in the words of Dr. Masihi, it doesn't make any sense. And second point, they said, do we need to shelter in place? Our answer is emphatically no. Do we need businesses to be shut down? Emphatically, no. And their third point, because COVID-19 appears to be much more widespread based on their data, the infection and mortality rates are very similar to the seasonal flu. And their fourth and final point, doctors are being pressured to attribute COVID-19 to deaths, even when it wasn't the cause. So here we have two doctors that own 7 facilities testing more than 5,000 people, sharing their data to help people make wise decisions. How do you think they're treated? Do a quick internet search for them and see the lambasting that they've received, especially from the media and other physicians. One headline from KQED stated, "The widely discredited Bakersfield doctors' COVID-19 test conclusions spread like wildfire." Yet, in the article, and in many others, the findings weren't disputed. They were wholeheartedly brushed aside and then smeared. The American College of Emergency Physicians released a statement saying in part, "These reckless and untested musings do not speak for medical societies and are inconsistent with current science and epidemiology regarding COVID-19. As owners of local urgent care clinics, it appears these two individuals are releasing biased, non-peer-reviewed data to advance their personal financial interest without regard for the public's health." Well, our retort back to them is, you know what? Quit the name calling and just prove them wrong. Look at their set of data and do your own research. YouTube felt so much pressure after pulling the original video, which had over 5 million views on it, that they issued a statement to 23 ABC News in Bakersfield. 23 ABC reported, a YouTube spokesperson issued a statement saying the video was pulled because the content contradicted the guidance of the local health authority. YouTube's quote follows, we quickly remove flagged content that violate our community guidelines, including content that explicitly disputes the efficacy of local health authority recommended guidance on social distancing that may lead others to act against the guidance, said the statement. However, content that provides sufficient educational, documentary, scientific, or artistic context is allowed. For example, news coverage of this interview with additional context. From the very beginning of the pandemic, we've had clear policies against COVID-19 misinformation and are committed to continue providing timely and helpful information at this critical time. And 23 ABC continued, Joseph Russomanno, a mass communication law professor at Arizona State University, said the doctor's controversial statements played a role in the video being removed. It would seem to me what YouTube's concern is the potential harm that this video may contain, said Russomanno. If you look at the content of it, contrary to what most members of the medical community are saying about COVID-19. So, does that make them wrong? Just because their data doesn't support official findings? Let's remind everyone again that initial models were drastically off regarding mortality rates. Plus, this whole flattening the curve mantra has been achieved by states and countries that didn't lock people down. To summarize Dr. Erickson, this isn't about safety, it's about control. And when dissenting voices are squelched, that's not freedom, it's democracy, mob rule, or even better, it's medical democracy. How much longer are Americans willing to put up with these totalitarian measures? It's been said that when you lose freedom, it's gone, and it may not ever come back. Well, you know what? Let's instead prove them wrong and use this as a wake-up call to boomerang their pressure back onto them. And in fact, let's apply so much pressure that we take back the freedom that we've lost for decades. It's time to regain some ground, to throw out tyrants and support heroes of freedom. No more wishy-washy politics. You either obey and respect the founding documents, or you're out. Join the John Birch Society today to get involved in our national program that works to protect and restore American freedom, liberty, and independence. Let's make freedom the cure. Share the New American article, which has embedded the original video of the doctors. This and other helpful links are in the video description. I'm Bill Hahn for the John Birch Society, and until next time, stay informed, stay active, and stay safe, Patriots.